Okay, so I'm going to tell you my injury story. Look, the reason that I'm here today is I was a swimmer, and I had anterior left shoulder pain when I was doing long sets or when I was swimming really hard, like high quality stuff. So I was a 200, 400 freestyler. The pain then started to move. It went from my shoulder and very rarely, and at the end of the week and end of a long set, down into my elbow and then into my hand. And eventually, every time I caught the water here and pulled, I got a lancinating pain into my hand. And it was catastrophic in terms of being able to train and race. The way it worked in Canada was you saw your team massage therapist, she didn't have a clue. And then you see the athletic therapist, he didn't have a clue. Then you see the physiotherapist, he didn't have a clue, he'd never seen that before. Then I got referred to the GP, all within the clinic on site. Then I got referred to the town sport med guy, he didn't have a clue. So then he referred me into Toronto to a specialist. By the time I got to the specialist in Toronto, I'm a year in now. I've modified all my training. I'm doing lots of kick sets. I've changed my weights. I'm training, doing lots of unrelated freestyle training, and I'm just don't understand exactly what's going on. And no one's been able to give me any answers, tell me exactly what's wrong with me. The specialist said that I looked a little bit scrawny and that maybe I needed to go to the gym and put on some weight and bulk up a little bit. And it was probably some sort of a minor muscle instability in my shoulder. So I asked him why not the other side, and he said he didn't have the answer. So he sent me away to do 6 months of exercise rehab without a program or a referral. So I did what any 21-year-old male did. I bought some bodybuilding magazines. So I read lots of fitness and bodybuilding magazines and bought some aminos and some protein powder and designed myself a program. And I hit the gym really hard because when everyone else was in the water, I was in the gym, right? So I hit the gym really hard. I put on a stack of muscle and got really strong. And 6 months later, I dove into the water. And the first thing I noticed was I couldn't even hit the glide position. I couldn't even get my hand up into this position. It was so stuck. So I was terrible. I couldn't even swim anymore. So I did what you do when you're in that age group and you don't know what you want to do with your life. I became a coach. So I became a swim coach. And I had some athletes who became injured, and I referred them to a guy in town. And they got better. So I thought that was good for them, but I saw it was a bit strange. So I met up with Bill for a coffee. And I said, tell me a little bit about Amy and Brian, and what'd you do, and how'd they go, and what's the prognosis? And then I said, I want to tell you about my shoulder injury. So I started telling him about my shoulder injury, and I got about 2 minutes in, and he just put his hands up. He said, I know what's wrong with you. Come see me on Tuesday. I said, okay. So I rocked up on Tuesday, and I went and saw him, and he said, anterior shoulder pain? I said, yeah. He said, where? I said, down in the elbow, then lancinating pain into the hand when oh yeah, that's fine. Laid me on my back and stuck his finger in my axle, in my armpit, and put his thumb in there. No one had ever actually touched in my armpit. Everyone else had worked around the front and back of my shoulder. The first spot that he touched brought all my anterior shoulder pain. I said, oh, that's my shoulder pain. He said, oh, that's good. And then he worked his way in a little bit further, and my elbow started to ache and down into my hand. I said, that's my hand pain. He goes, I got it. And then he just held that spot, and he slowly pulled my arm up back into this position here 3 times. Then he checked a couple of other little things and picked me up and said, really good today. Great job. See you Thursday. So I went out to the front, and I paid, and I made an appointment for Thursday, and I came back on Thursday. He did the same thing again, but this time it didn't hurt. He didn't bring on any pain. He said, look, I think you're quite good, but I just want to be thorough. I'll check you on Tuesday. I think he just wanted some more money. So I came back on Tuesday, and there was nothing to be done. And he got me up, patted me on the back. He said, great, we're all done. And I said, what do you mean we're all done? He goes, I fixed you. I said, what do you mean you fixed me? He said, go for a swim. It's gone. Trust me. So I went to the pool, and I put on my togs and my goggles, and I dove in. And the first thing I noticed was I actually dove in. I hit the glide position, which is hard to do in a suit jacket. And I started swimming because I thought it was going to come back. I said, oh, it's a joke. There's no way. So I started swimming, and I swam harder and harder and harder. And I swam for 2,500 meters that day, which is 100 lengths, and no pain. And it's never come back. So what had happened is I had either through the weight room or through diving in inappropriately or through, whatever I'd done, I had strained my subscapularis muscle, which is in my axilla. And it is the primary stabilizer of the actual glenohumeral joint. The nerves and blood vessels to your hand cross across the front side of subscapularis. The ulnar nerve comes from the medial cord of that, so the one that's closest to the ribs. I had gotten scar tissue from that strain injury of my subscapularis around that bundle. When I fired my subscapularis muscle, the nerve is supposed to slide. My nerve could no longer slide. It became crushed between the muscle and the rib that lied in front of it on a bony prominence. That brought on the hand pain. The nerve was being compressed. He reached in and found that spot, moved off the nerve and trapped that muscle, and then slowly teased the nerve free. Then he went in and found the trigger point in the muscle and manually released it. That got rid of my anterior shoulder pain. So I had 2 lesions that day. I had subscapularis trigger point that gave me anterior shoulder pain. That's how the story began. It got worse when it trapped the nerve that went down into my hand. I reckon he fixed me the first day. If I was treating me, I would have said after the first treatment, I think you're done. He fixed me. And so I phoned him about 6 months later when I'd had it with being a swim coach, and I said, what is it that you did to me that day, Bill? And he started talking to me about his, Olympic credentials and going to Commonwealth Games. I said, no. What's that thing that you did with your hands that no one else has done to me? He goes, oh, that's a system of matching symptoms, anterior shoulder pain, to diagnosis, it's in subscapularis, to treatment, I'm going to pull it free now. It's called active release techniques. And when you use a system and you use the same system all the time, you tend to get better, more reproducible outcomes. So there's a group of providers who do this, and we all sort of practice the same way, and we get a reproducible outcome. And it doesn't matter where in the body the injury is. We know that anterior shoulder pain, 3 places. Lateral elbow pain, 14 places. We've got a checklist. It's about learning a checklist. I said, great. So I got into Macquarie to become a healthcare provider, to do my master's at Macquarie. And before I went to Macquarie, I went to the States and I learned ART from the guys who invented it, and then brought it out here. After about 6 months, there's a newspaper article written about my non-surgical treatment of carpal tunnel patients in the Sydney Morning Herald. That newspaper article ended up at an abattoir in New South Wales. They phoned me and said, we've got one slaughterman post-surgery who's no good, and another one pre-surgery who doesn't want the surgery for carpal tunnel. Can you treat them? I said, yeah, send them. They sent 2 of them to Parramatta, where I was practicing. I treated them over the course of a week and sent them back. They were excellent cases. They were fit, they were young, they were just stuck. They had nerve entrapments, they had adhesion, same thing that I had. The woman the following week phones me up and says, hey, look, great job with those 2 guys. They're both back at work on full duties. We're really happy with how they progressed. There was one problem, though. And I thought she was going to talk about the invoice. And I said, what was the problem? She said, well, they just drank way too much, and they've told all their mates. So we can't send you anymore because it's a paid vacation with free alcohol. I said, well, what do you want to do? She said, well, why don't you come to us and have a look at a few of our problem cases and see if you can fix them as well. So they sent me a plane ticket. Following Thursday, I flew out, and then the next Friday, I went, rocked up at 6 when they started to kill at this abattoir, and I met Kylie, and she hands me a sheet of paper, and and I look at it, and it's full of names. I said, how many names are on this page? And she said, 55. And I said, how many people work here? And she said, about 550. And I said, 10% of your workforce wants to see me today. And she goes, no, turn it over. There's another 55 names on the back. 20% of the people working in that abattoir today had a musculoskeletal condition that they wanted seen. And I think that's very typical of the workforce. Musculoskeletal pain is common. What we don't do very well with it is turn it into the flu, and we don't fix people. We treat them till we get them out of pain, and we label them as stable and stationary, and off they go. We know how to fix people. So when people are broken, if we can't fix them, we refer them on. If we can fix them, we do it quickly. We restore function, and we then rehab them as part of the treatment. So that's why we get different outcomes. We approach them differently.